Why are more people under 50 years of age being diagnosed with bowel cancer? In this video, discover the shocking trends and what factors contribute to it. Towards the end, I will talk about ways to reduce the risk. Personally, I have lost some colleagues to early onset bowel cancer, and it was very devastating for all concerned, as you can imagine. Welcome to Health Tips with Shalom Health. Thanks so much for watching today. Please make sure you subscribe and hit the notification bell so you never miss a new video. This information I'm providing is as accurate as possible as at the time of posting it. Remember though, of course, that it is for information purposes only. It is not medical advice. Please don't make any changes in your health regimen without talking to your doctor first. What is bowel cancer? Bowel cancer, otherwise known as colorectal cancer, is a type of cancer that affects the colon, which is the large intestines or rectum. It is the third most common kind of cancer worldwide. It can cause severe harm and death. The earlier bowel cancer is spotted, the more treatable it's likely to be. Early diagnosis is not always possible as there may not be the typical symptoms in the early stages. The scale of the problem. It used to be thought that colorectal cancer was a disease of older people, but it is sadly not so anymore. In 2019, according to a report by the American Cancer Society, 20% of colorectal cancers were in people aged 54 years or younger, whereas it was 11% in 1995. In the United Kingdom, the trend is increasing as well. About 6% of all colorectal cancers diagnosed are in people under 50 years, and it continues to increase. The charity Bowel Cancer UK interviewed some of the young people that were diagnosed, and it was found that half of the people did not know they could have cancer at that age. 1 in 3 delayed seeing their doctor for at least 3 months, and some of them were not aware of the symptoms of bowel cancer. And 4 out of 10 of them had to make at least 3 visits to their doctors before they were referred. Now I'm going to go on to the reasons for the increased incidence. Several factors have been identified as contributing to this rise, although the exact cause is still not fully understood. Some of the key reasons include dietary factors. Diets high in red and processed meats, such as sausages, bacon, and other meats that are preserved by smoking, curing, or salting, have been linked to a higher risk of bowel cancer. A diet low in fiber, such as one with minimal fruits, vegetables, and whole grains, may contribute to an increased risk. A high intake of sugary foods and drinks, along with increased calorie consumption, may contribute to obesity, which is a known risk factor for bowel cancer. Overweight and obese individuals have a higher risk of developing bowel cancer, especially as early onset cases are being observed more in those who are obese. A sedentary lifestyle is another risk factor for colorectal cancer. Exercise is thought to help regulate hormone levels, inflammation, and gut health, all of which play a role in cancer prevention. Certain inherited genetic conditions, such as Lynch syndrome and familial adenomatous polyposis, significantly increase the risk of early onset bowel cancer. Genetic causes account for 5% of all colorectal cancer cases. This percentage has been steady throughout the years, and researchers have not been able to find a connection between genetics and the increase in cases, according to the Royal Marsden Hospital website. Genetic mutations. Research indicates that some genetic mutations, whether inherited or acquired, may predispose younger people to colorectal cancer. An imbalance in gut bacteria may lead to chronic inflammation, which is thought to contribute to bowel cancer risk. Conditions like Crohn's disease and ulcerative colitis, which are collectively known as inflammatory bowel disease, which cause chronic inflammation in the intestines, increase the risk of developing bowel cancer. There has been a rise in IBD diagnosis among younger people, which may correlate with the increase in colorectal cancer. Environmental toxins, such as those found in tobacco smoke and certain chemicals, have been linked to colorectal cancer. Younger people might be more exposed to certain environmental risks due to changes in lifestyle, such as increased smoking or drinking at younger ages. Drinking alcohol, especially in larger quantities, has been linked to an increased risk of colorectal cancer. Young adults may not be fully aware of the risks associated with alcohol, which could contribute to the rising incidence in this age group. Colorectal cancer is traditionally seen as a disease affecting older individuals, which sometimes leads to delays in diagnosis when symptoms appear in younger patients. By the time it is diagnosed, cancer may be more advanced in younger patients, making it hard to treat effectively. Lack of screening for younger populations. Current colorectal cancer screening programs generally target those over 50. Without earlier screening in younger people, cancers may go undetected until they progress. Many countries have so far taken steps to bring forward the age at which screening starts. Hormonal and lifestyle changes. Insulin resistance. Conditions such as type 2 diabetes, which are often linked to metabolic syndrome, obesity, and poor diet, have been associated with a higher risk of colorectal cancer. Insulin resistance leads to higher levels of insulin and insulin like growth factors, which may promote cancer cell growth. Changes in societal norms, including the rise of fast food culture and urbanization, may also influence lifestyle choices that increase cancer risk. Increased awareness and improved diagnosis. There has been an increased awareness of colorectal cancer in younger populations thanks to the work of various bowel cancer charities, and diagnostic methods have improved. This may result in more cases being detected in younger individuals. Now, I will go on to talk about ways to reduce the risk of bowel cancer. Getting regular exercise, eating a diet that includes lots of vegetables, fruits, and whole grains, and less red meat and processed meats. Maintaining a healthy weight. Quitting smoking, drinking less alcohol. Informing your doctor about a history of bowel cancer or colonic polyps in your first degree relatives, that is, your parents and your siblings. Getting screened regularly. In the UK, bowel cancer screening is offered to everyone aged 54 to 74 every 2 years, and there are plans to reduce the age of starting screening to 50 years. Higher risk individuals, for example, those with a family history of bowel cancer, are tested more frequently. Points to note. Whilst many of the predisposing factors discussed are interconnected, lifestyle and environmental factors seem to be driving much of the rise in bowel cancer among under 50s. People with a family history of bowel cancer must start screening sooner than the general population. Please see your doctor so that you can be referred to the appropriate service. Paying close attention to your body and detecting early warning signs is important. The earlier a diagnosis is made, the more likely it is that treatment will be successful. More information. There are other videos on this channel that deal with how to live a healthy lifestyle using the 9 pillars of health and how to reduce cancer risk in general, as well as other health topics that you may find useful. Please watch them for more information. It would be nice to hear of your experiences of the symptoms of bowel cancer, either in yourself or in people you know, so that other people may learn. Please do that on the comments page. Please like, share, or subscribe to our channel for more eye-opening content like this. Stay curious and stay informed until next time. Thanks for watching. God bless.